another thing we find gets missed is, there's infections that drive obvious infection. You get a high fever, you're like, oh, I got an infection, the cold, flu, COVID, that kind of stuff. There's other bad bugs that drive chronic disease. So these are the infections that basically get in with like this cloaking device. And when I talk to the people that are very familiar with the Harry Potter series of movies, there's the first one where Harry and Ron Weasley, they have the cloak of invisibility, and they're able to put it over and they get into the library to look for the book. Well, it's kind of like these bad bugs that drive chronic disease have this cloak of invisibility. They get into the body and they hide from the immune system. So the immune system doesn't respond with a high fever, and all this kind of stuff. So they get in, they hide, but over time they're able to start creating inflammation, and it just builds over time, driving chronic disease. And we tend to know which ones these are, though, and we can test for them. So, of course, you can get chronic infections in the gut, and then that whacks everything. But you get chronic infections get in the bloodstream, go all over. Epstein-Barr virus is one of the ones that people maybe hear most about, but then the other ones that are quite common include herpes virus 6, Coxsackie viruses, mycoplasma, all the tick-borne diseases, and easily testable on a blood test. Now, they can be a little hard to find on a blood test. By the time we see people, they're usually so unhealthy that it's pretty easy to find them. We know they're there even before we test, of course, but if the bug is really good at hiding from the immune system on a blood test, we're kind of in our infancy on how we test for these things. We have to look for antibodies being produced by the immune system against this certain bug. And if you see antibodies against the bug that should never have gotten in your body in the first place, that bug is there driving the chronic disease. And we go, okay, we got to get rid of it. But if the bug can hide really well, you won't see antibodies anyway. So part of it is you got to know they're there, whether you find them or not. Now, Epstein-Barr virus is a little different because it gets in everybody. So everybody has some antibiotic or antibody production against Epstein-Barr virus. Trying to kind of keep it at bay, kind of make sure it never rears its ugly head. Because if it rears its ugly head, it drives chronic disease. Probably the first disease associated with Epstein-Barr virus was multiple sclerosis, for example, right? And so a couple of antibodies, no big deal. But what you see on blood tests is antibody production is so high against the Epstein-Barr virus, they can't even count that high. So whether somebody may have like 30 or 50, you go, nah, it got in at one point in your life, usually within a few months of age. You have a couple antibodies produced, but it's not an active infection. But when you see titers more than 600, you go, oh my gosh, there are so many antibodies being produced against this bug, you can't even count that high. Oh my gosh, is that a big fight? Your immune system against this bug, that bug is driving the system crazy. And so you got to get rid of it. And truly, this is like all chronic disease. So even like childhood leukemia is driven by Epstein-Barr virus and this herpes virus 6. But people kind of misinterpret that. They go, well, these are very common to be in humans. So when we find them in these kids with childhood leukemia, we don't find any unusual ones causing this disease. We just find the usual ones that are in most people. And we're like, yeah, because they're the usual ones that drive chronic disease, of course, right? And so they're like they're in so many people. Now, you want a healthy immune system to keep these bugs quiet, dormant. Now, some of them, like herpes virus 6, mycoplasma, Coxsackie viruses, they should never get into the human body. You get rid of them as you reverse the chronic autoimmune disease, chronic disease, and then now hopefully your immune system is so healthy, it never lets them back in again.